Dopamine levels. Dopamine, often referred to as the feel-good neurotransmitter, plays a vital role in our brain's function and overall well-being. What are dopamine levels? A neurotransmitter associated with Parkinson's. Dopamine is a neurotransmitter, which is essentially a chemical messenger in our brain. It acts as a bridge for communication between nerve cells, transmitting signals that control various bodily functions, including mood regulation, movement coordination, and reward responses. Think of dopamine as the conductor of a symphony, coordinating the complex orchestra of our brain's activities. Why dopamine levels? A neurotransmitter associated with Parkinson's. Dopamine levels are closely associated with Parkinson's disease, a progressive neurodegenerative disorder that affects millions of people worldwide. In Parkinson's disease, the brain gradually loses its ability to produce sufficient dopamine, leading to a range of motor and non-motor symptoms, such as tremors, muscle stiffness, and mood disturbances. Understanding and monitoring dopamine levels are crucial in managing Parkinson's disease and assessing the effectiveness of treatment strategies. Common dopamine levels, a neurotransmitter associated with Parkinson's. Several factors can influence dopamine levels in the brain. Some common reasons for alterations in dopamine levels include Parkinson's disease. As mentioned earlier, this neurological condition is characterized by a significant reduction in dopamine production, resulting in movement difficulties and other symptoms. Medications. Certain drugs, such as antipsychotics and some anti-nausea medications, can impact dopamine levels. They may either increase or decrease dopamine activity, depending on their mechanism of action. Substance abuse. Drugs like cocaine and amphetamines can lead to a surge in dopamine release, contributing to the euphoria experienced by users. However, chronic drug use can deplete dopamine reserves over time. Stress and mental health. Stress and mood disorders, like depression, can affect dopamine levels. Low dopamine levels are often associated with feelings of sadness and lack of motivation. Interpreting dopamine levels, a neurotransmitter associated with Parkinson's. Results. Dopamine levels are typically measured through various imaging techniques, such as positron emission tomography, PET, scans and single photon emission computed tomography, SPECT, scans, as well as through cerebrospinal fluid analysis. The results of these tests provide valuable information about the concentration of dopamine in specific regions of the brain. For instance, in Parkinson's disease diagnosis and monitoring, a lower than normal dopamine level in the basal ganglia region is a common finding. However, interpreting dopamine levels can be complex, as they vary depending on the specific brain region and the individual's age and health status. How the test is conducted. PET scans. During a PET scan, a small amount of radioactive material is injected into the bloodstream. This material binds to dopamine receptors in the brain, allowing the scanner to create images that highlight areas with abnormal dopamine levels. It's a non-invasive procedure and usually takes about 30 to 60 minutes. SPECT scans. Similar to PET scans, SPECT scans use a radioactive tracer to visualize dopamine activity in the brain. This test is also non-invasive and takes around 30 to 60 minutes. Cerebrospinal fluid analysis. In some cases, a sample of cerebrospinal fluid may be collected through a lumbar puncture, spinal tap. The fluid is then analyzed to determine dopamine levels. This procedure is more invasive and may be performed when other tests are inconclusive. For whom this test is for and what diseases this test is for. The evaluation of dopamine levels is primarily relevant for individuals who exhibit symptoms of neurological disorders, particularly Parkinson's disease. If you or a loved one experience any of the following symptoms, discussing a dopamine level test with a healthcare professional is advisable. Persistent tremors, especially at rest. Muscle stiffness and rigidity. Slowness of movement, bradykinesia. Balance and coordination problems. Changes in mood or cognition, such as depression or memory issues. In addition to Parkinson's disease, monitoring dopamine levels can also be relevant for other conditions that involve dopamine dysregulation, including schizophrenia. An excess of dopamine activity in certain brain areas is associated with this psychiatric disorder. Medications used to treat schizophrenia often target dopamine receptors. Depression. Low dopamine levels are linked to feelings of sadness and lack of motivation, which are common symptoms of depression. Understanding dopamine levels can help guide treatment choices. Addiction. Dopamine plays a key role in the reward circuitry of the brain, making it relevant in addiction treatment and understanding substance abuse disorders. Conclusion. Dopamine levels are a critical aspect of our brain's function and play a central role in various aspects of our health and well-being. Monitoring dopamine levels through imaging techniques and cerebrospinal fluid analysis can provide valuable insights into the diagnosis and management of neurological conditions, particularly Parkinson's disease. If you or someone you know is experiencing symptoms related to dopamine dysregulation, consulting with a healthcare professional for further evaluation and potential testing is essential for timely diagnosis and appropriate treatment. By understanding and addressing dopamine levels, we can take significant steps towards improving the quality of life for individuals affected by these conditions. Your health matters for us. We are Quali.Health. If you want to effectively protect your health, get your all-access health pass at www.quali.health. Our health skills provide valuable information and guidance on specific health conditions.